Hi, my name is Erica. I'm a registered nurse. I'm here today to talk to you about the importance of using proper technique for collecting blood cultures in the emergency room. The contamination of blood cultures in the emergency room is actually a major problem. The contamination can lead to misdiagnosis or undiagnosis of patient infections. It can lead to extended hospital stays, and it actually causes millions of dollars in wasted healthcare dollars annually. So knowing the proper technique and using the proper technique are definitely ways that we as nurses can help reduce the risk of contamination of these blood culture bottles. There are a few key points here to remember. First being that you need to know your facility's specific procedures in place for collection of blood cultures. They may vary slightly from facility to facility. The one thing that is across the board is that sterile technique is preferred above clean technique. It just reduces the risk of contamination of the cultures. Another thing to consider is different materials used can be from different manufacturers. Knowing your facility's specific materials. For instance, the blood culture bottles, you're never going to want to go on color alone. Know which bottles are anaerobic and which ones are aerobic. We have two different types here. These are both anaerobic and these are aerobic. You are going to want to first do your anaerobic and then do your aerobic bottles. Another point to consider is that if you don't have enough blood for both, fill the aerobic bottle first. The ideal amount of blood would be 10 cc's of blood per bottle, 20 cc's total per set, which leads us to another point. Know your orders. If the orders do require 2 sets, you are going to want to wait 15 minutes in between collection of both of the sets, and you're going to want to use different access sites to collect the blood at those intervals. Another important point to consider is the fact that culture bottles should be obtained prior to the administration of any medication, specifically antibiotics. Antibiotics being in the bloodstream would of course make the results of any cultures unreliable at that point. So first, what we're going to want to do, get our order, verify those orders, verify our patient, have your patient labels there and ready, and verify that those patient labels are for the correct patient. You are going to want to use the chlorhexidine strips. Once you find the access site, once you have it palpated and cleaned with the chlorhexidine, try not to palpate it again. Obviously at that point it would no longer be sterile, but you're going to, for 30 seconds, using back and forth technique, clean the site. And then let it dry for 30 seconds. Again, this would be sterile technique, so imagine these are sterile gloves. And once that has dried for 30 seconds, I'm going to go ahead and use our venipuncture and collect the blood. and we're going to get 20 mLs ideally is our goal. Obviously that can't be done with every patient for various reasons. Get as much as you can. If you cannot get 20 mLs, try and get at least half that, and you would fill the aerobic bottle. All right. So we have our blood. We're going to go ahead and remove the needle from the skin and hold the pressure with the gauze and apply the adhesive bandage. Sharps container. There's several different needles you can use. The transfer needle would be here. Again, you would have all of this set up as part of your sterile field. You're going to remove the caps of the blood culture bottles, and you're going to swab them with chlorhexidine. And then you're going to inject into the bottles. They are pressurized. You're going to want to control the flow with your fingers. Okay. At this point, you're going to make sure you have both of the bottles labeled with all your patient identifiers and the times as well, and place them into the containers and send them to the lab promptly. Again, when the second set of cultures is required, 15 minutes in between each. Make sure that they are labeled with the times of the collection and the sites of the collection. And then at that point, you could administer any antibiotics that might be ordered for your patient, or anything like that. For follow-up of the venipuncture sites, just make sure that the bleeding has been controlled as well. And I hope you enjoyed this video and you learned proper technique. Thank you so much for watching. And this is my husband Jason, who helped set this up. Thank you, Jason.